Back in the day, if you needed medical attention and your primary care provider was closed or couldn't make an appointment for you immediately, you had to go to the emergency room. In this week's Doc Talk, CBS 21's Ed Russo shows us the importance of how urgent care facilities make it easier to be seen for last-minute non-emergencies.
The following segment is sponsored by Geisinger Holy Spirit.
Getting sick or hurt can happen anytime, but it doesn't necessarily mean you need to visit the ER.
Urgent care system was created to fill important gap between the services provided by your primary provider, whether this is a family doctor or internal medicine specialist or a pediatrician, and the services that can or have to be provided by emergency department.
Urgent care is a good option for immediate medical attention when it's not an emergency, such as allergies, sprains, and/or headaches, and most fevers fit this bill. However, fevers should be taken more seriously for toddlers and the elderly.
If you have a chest pain and you're suspecting that it might be, even if there is a remote possibility that this might be issue of a heart problem, the place to go is emergency room. If you have severe abdominal pain, an emergency room would be also the preferred place.
If you have difficulty breathing, experience passing out or loss of consciousness, loss of vision, and strokes, then the ER is the place to go. Remember that an urgent care visit is almost always going to cost less than an ER visit, sometimes much less.
The utilization of your emergency room goes with the higher cost. And most the insurance companies are setting up the level of your copay much lower for the urgent care than emergency room.
So it's very important to distinguish between what is a true emergency and what is not. People with a higher priority illness will always be seen first, which means you could be waiting much longer in the ER than an urgent care facility. For this week's Doc Talk, I'm Ed Russo for CBS 21 News.